At TinyKittens, we rescue the unrescuable. We work mostly with feral cats, and we tell their stories on social media because they are some of the most misunderstood yet remarkable cats. And if we can understand them better and inspire more compassion toward them on a global scale, then we will have a big impact on cat overpopulation. As some of you have seen, we also live stream the cats and kittens we rescue 24/7, and definitely invite all of you guys to join us at TinyKittens.com. It's live, uncensored rescue reality, so you guys will really get to see everything that's involved in saving our cats. So we laugh, we cry, we get to see Renee do really badass vet things, and some of the people in this room have witnessed some of my most embarrassing moments. So Renee and I met about 10 years ago. I had just started live streaming and thought it would be cool to have a vet come on our live stream and answer questions for the viewers. And I asked around all the vets that I knew, and they all thought that was weird. So then I saw an article in the local paper about Renee and her new vet clinic opening, and her husband had said something about how high-tech she was. And, and so I was like, oh, that's her, she's the one. So I bait and switched her, and I told her that it was going to be all really adorable kittens, like they'd be super healthy, no big deal, nothing too intense, nothing scary. And then I met these guys, the jungle kittens, and they were my first introduction to feral cats, and they were really, really sick. So Renee and I spent the next few months trying very hard to keep them alive, and they're the reason that I became obsessed with feral cats.
Shelly and I have learned a lot over the past decade together. We really evolved how we rescue, our medical treatments, our surgical protocols, and even right through until closer. It really right through until we place these cats into their homes. And we've learned a lot over, like I said, we learned a lot, and we're really excited to share some of these things with you today.
So after the jungle kittens, I was reading everything I could find about feral cats. And by the time we started our first TNR project, I had some assumptions. And those assumptions were completely wrong. So I thought feral cats are solitary and are not social with each other. I thought they have poor quality of life, and like you would never see them doing things like playing or frolicking in the sunbeam, that sort of thing. And I also thought you could not handle a feral cat under any circumstances. And what that meant is that we would have to euthanize potentially healthy cats if we weren't able to treat everything that was wrong with them within that very brief spay-neuter appointment. And Renee had some really great assumptions too that were equally wrong.
So yeah, my early assumptions when we started working with TinyKittens and the feral cat population were my early assumptions, and maybe they're the same assumptions that some of you guys have as far as this goes. I assumed that my staff and myself, we were going to get hurt all the time. Second, I assumed that doing work with feral cats was going to really decrease our staff morale, and that I was going to increase my staff burnout. The third thing is I thought that we would be euthanizing cats that otherwise I thought we'd be able to treat if they had been previously socialized.
So when we got involved with our first massive feral colony, I wasn't feeling great about some of the decisions we were supposed to be making. So I began to test my assumptions and spent a ton of time studying the cats and started to see ways we might be able to do things differently. So fast forward to today, and we have been able to successfully treat 100% of the feral cats we've trapped who have had treatable illnesses and injuries. So,
And it's more than the cats just getting treated by like any means. These cats have been treated compassionately, and in the clinic we've had no more scratches or injuries than we would with any other feline patient. And I can't even remember the last time my staff or myself were injured at all. The other part is that's really become really special to me is at our hospital now, when we see these feral cats, it's actually a big part of our favorite part of the day. Everybody in the staff looks forward to them coming in, and it's the opposite of decreasing staff morale. It really gets everybody pumped up. And it's given us some really exciting medical and surgical challenging cases. And we've had as many sometimes of these cats having like 6 medical conditions at once, and watching these things get fixed and checking them off the list as like, it's just awesome. And so it's been really, really amazing. One story that's a perfect example of what these cats are capable of giving the right environment is Moggy. I re-showed this to my staff recently when Shelly decided we were going to share this story, and people started to tear up. And you can also note he had a beautiful eye surgery, so hopefully you like his eye look at the end.
I feel like I get teary every time I see it too. You can see he's starting to, So you can see total transformation. He even loves belly rubs. So Moggy's probably one of my favorite rescue stories. His transformation was so spectacular. And we've seen tons of amazing transformations. But he was just so pathetic when he came in, and so sad and just so sick, and now he's living the best life ever. And this is possible for every feral cat. So so of course, not all ferals want or need to be socialized with humans. So while we're treating them, we are constantly assessing. And it's usually pretty clear by the time they're healthy whether they would be happiest returning to their homes in the wild, or if they may be happy living in a home with humans. And one of the most exciting things for me has been that we've been able to follow these cats, the ones that we've treated and returned to the wild, and the ones we've adopted into homes. And we have data that confirms that that these cats do go on to live happy, healthy lives, whether they're in a home or whether they return to the wild.
I've been fortunate enough to see some of these former feral cats become long-term patients of mine. That these are the cats that choose to live with humans, and they are the most awesome appointments. They do not have any special warnings on their files. They don't have any extreme caution markings. They just come in with the same emotional preferences on their file as any of the other feline patients that I see. It's what are their favorite treats? Do they want to be examined on the floor? Do they want to be examined on the table? Do they prefer being examined in their carrier? Should we use a towel or not? So not only do I get to see how these cats are doing, but I also get to see how much joy they bring into people's homes. It's really awesome.
It is awesome. So So
Those are also some of my patients.
yep. Feline leukemia positive, and her brother, doing great. So let's talk about why adopting a formerly feral cat is the best thing ever. I think this slide speaks for itself, really. He was affectionately named Mega Nards at our feral colony by the volunteers because he was very manly. And anyway, so he's had many medical issues. Very happy in a home now. If you ever want to be cool on the internet, what more could you ask for than a formerly feral cat that has, all of that personality and uniqueness? Also, feral cats are notoriously good at getting along with other cats, and some even have doggy best friends too. You'll also be a hero because you're literally saving their life. And I can tell you that it feels really good knowing that you can replace a lifetime of hardship with love and comfort and the pampered life they deserve. Like the first time a formerly feral cat experiences one of these fuzzy beds, it's pretty amazing. And I do see some of our amazing former feral adopters here today. Yeah, give them a hand. They're all awesome. So I have to ask though, would you guys do it again?
Yes!
Okay, good, thanks. So we do have several repeat adopters because they adopt a cat and it's like the best thing ever. No. So anyway, so now that the rest of you obviously can't wait to fall in love with a former feral of your very own, here's what you need to know. So we see all the time feral cats being described as mean or angry because of how they can react to humans. But what we all need to understand is that those reactions are rooted in fear and anxiety, and often pain can be a factor as well. They just haven't learned yet that humans can be good and they really want to survive. So it's just like you or me, if I feel threatened or powerless or scared or am feeling vulnerable in an unfamiliar environment, I know I can definitely react and lash out in ways that some might label as angry or mean. That's not who I am, I think. But it is how my brain is wired to respond when it perceives a threat. So once we understand that we're dealing with a scared cat and not a mean cat, I think that really helps us relate more accurately and more compassionately to what our cats are feeling. And once we get to that point, we can really connect and tailor how we interact with them so that they can live their best lives.
Part of the cats living, is this working? Is this working? So part of the cats living their best lives is environmental enrichment. This is something that I've become really passionate about in the past few years. And what that is taking into account the cat's safe space in the environment and in the environment at home. So not just with feral cats, but with all of your cats at home. The first thing is to sit down on the floor and look at your environment from the cat's perspective. The first thing is think about the sense of smell. Don't use any cleaning agents that have a strong odor. Try to use, if you can, any feline pheromone sprays, diffusers. The other thing that you can do also for environmental enrichment is create a sniffari in your house. I recently learned about you can go and pick some dandelions outside, or some rose petals, or some lavender, and place them around the environment in the inside of your cat. And it gives them a little bit of a sniffari. And it gives their brain a little bit of a mental puzzle. I remember one of my favorite stories is Shelly telling me that she's just driving home from gathering a bunch of objects from the outdoors, which included, I think, a small tree and a log, probably some insects. I said there were not be any raccoons.
Lots of spiders.
Lots of spiders. And she brought all of those things at her home, which was the rescue at the time. And she set it up to enrich the cat's environment so that it would decrease the stress for the cats. I don't think we all need to go to this degree, but I think it was a pretty cool idea, and she was ahead of her time. The other thing you can do to take into account the cat's environment is address the sound. What we really want to do is we want to sort of make it quiet and free from loud noises and from unpredictable noises. There's some really cool apps. There's one called Through a Cat's Ear that's on like Spotify or iTunes, and that can really drown out some external noises that can decrease the stress in the cats. The other thing is that, as you guys know, there's cat television that has like birds and stuff on it that can provide some good background noise for the cats also. The other thing you can do in your cat's environment when you're sort of sitting down and looking is increase the vertical spaces. Giving the cats some chances to get up and sort of act natural. And in addition, some nice, safe hiding places. But also remember the hiding places you have to be able to get to if necessary too. Provide some visual stimulation. Make sure, as you guys probably already know, is that you want to make sure there's windows, and if possible, nice, good, safe screens on the windows so you can even open it so the cats can hear and smell the outside. The other thing you want to do is provide multiple feeding stations, water stations, and litter box stations. You don't want them all in one corner. They've found through studies, it really decreases the cat's stress if they have lots of options. So nice big wide water bowls in different areas. The other thing that you can do is rotate toys. And Shelly has a good example here, is something we've also really started to do and I've really encouraged owners to do, not just formerly feral cats, but all cats, is cooperative care and counter conditioning. What we're doing is we're teaching the cats to become part of their medical treatment, using this as like true, or there's some delectables, and the cats really create a positive association with whatever we're trying to accomplish. We've actually even done blood collection from cats for when we've needed blood donors at our clinic with the same level of stress, using these types of techniques because the cats are socialized and we love the chew. The other thing is I have another patient that comes in that loves to be brushed. The owner brings in the brush. So I'm sitting there examining the cat with one hand, and the other one I'm brushing the cat. So these are great techniques that you as owners can do at home for any cat.
So some of the things we do at TinyKittens can also really help reduce stress at home. One of the best things you can do when you bring your cat home is to have safe spaces set up that are easy for humans to access, but still feel safe for cats. So we always ask our adopters to block off the spaces under their beds and under large pieces of furniture, because that's often the first place a cat will go to hide. And if you bring them home and you open the carrier and they run and hide somewhere you can't reach them easily, you won't be able to monitor how they're doing, and you won't be able to start having those first few essential positive interactions with them, which will really hinder your ability to help them feel safe as quickly as possible. Something else that we've observed specifically with our former ferals is that most of them are really reassured by touch. And so it's really important for you to keep interacting with them in a way that reassures them, rather than waiting for them to come to you, because they're going to be too scared to do that on their own until they get that reassurance first. And we all know that every feral is a unique individual, and so we will pass along all the things we've learned specifically about your cat, like how and where to pet them, how to considerately approach them so that you're not super intimidating, and even how they like to take their meds, so that you know where to start and what to expect from day one. And then once they're home with you, you want to observe and try to figure out what scares them and what they do when they're scared. Because learning things like that will help you eliminate those triggers and also make sure you know how to help them recover as quickly as possible when something scary does happen. So for example, this glorious creature is my two-legged cat, Cassidy, aka Puff Puff, aka the Miracle Kitten. He has a lot of triggers. Probably his biggest trigger is stranger danger, which I can relate to. When he hears a knock on the door, he panics and goes flying into my bedroom and under the bed, and I feel terrible every time it happens. So now I have a sign on my front door that says, "Please don't knock." And anytime I know someone's coming over or I see a delivery truck pull in, I will immediately carry him into the bedroom and close the door and either stay with him or turn on an interactive toy for him or give him a treat puzzle. And that has really, really helped. When he does get scared, I've learned that treats are the fastest way to get him feeling safe again. And if he's still showing signs of hypervigilance after that, I might also give him some gabapentin. And one last tip that's been super helpful for us at TinyKittens, we use security cameras and of course our live streams to monitor all sorts of things about the cats. So we can monitor like respiration, mobility, litter box habits, and especially in the home, it's really helpful to be able to see them interacting with the other pets. And it's a great way for you to make sure that they're playing and engaging in other normal, happy cat behavior when you're not around.
So a big stress to cats historically and to owners is actually getting them to the vet. And I love teaching owners techniques to decrease the stress for both the owner and for the cat. Also, I feel like I just keep doing eye surgeries for you. Like
So many eyeballs.
So there's some things that you can do as cat owners that can help us do much more thorough exams and create a much less stressful visit. The first thing is what I love, and Shelly and TinyKittens is great for this, is create a list of concerns. I love when I get a list and I get a cat where I want to be thorough and I want to be really conscientious of how I'm going to examine this cat if I have the list. The other thing most vets love these days is smartphones. If there's a mobility issue, bring a short video clip in with you to the vet, because chances are that kitty is not going to walk in the same way when they're in the exam room as they did at home. But also, if there's a little bit of a weird behavior, it's really kind of cool if you can sort of actually capture it in a really short video.
I send Renee poop videos all the time.
Oh, I know. Sometimes I'm driving beside my husband and he's like, "What?" And I'm like, and he's getting used to it.
She loves it.
Yeah. He's like, anyways. So have a list of concerns, short videos. The other thing is bring your cat's comfort items to the vet. For Cassidy, that is Oracuda, one of the other comfort cats. So that's okay, and a lot of vets are okay with that too. Also bring your cat's favorite items. Maybe it's their favorite blankets, their favorite stuffy. Also try to use, if you can, some calming pheromones on top of the blanket. The other thing that really decreases stress is pick a carrier where the lid comes off. So if the cat chooses that it wants to be examined inside the carrier, we just take the lid off and then the kitty can stay in the carrier.
So awesome.
Yeah. The other thing to do is during transport is have a blanket or a towel over top of the carrier because the cats feel so much more secure. The other thing is also consider, and I'm going to talk more about it in a sec, some gabapentin 12 to 2 hours prior to the vet visit or any stressful event. The other thing that we have learned is that, or that I learned recently, is keep the cat carrier in the cat's environment all the time if possible. If it doesn't match your couch, cover it with a blanket that matches your couch. Because then when the cat does go to the vet, it perceives that its environment is coming to the vet and it feels way safer. There's also some vet and handling techniques that we do at the clinic, but I also think that owners can do them at home, so that's why I bring them up. And there's also some rescues here. I'm probably already using it, but I think the more I teach owners, I think the owners really absorb this and they start doing this stuff at home too. What you want to do is consider a considered approach. What that means when you're about to handle the cat or do any sort of procedure is take into account the environment. From the cat's point of view before you're about to do anything, when we were dressing before, like the sound, what's going to make the cat comfortable. Also use a touch gradient. How can you comfortably and safely position the cat? The other thing that we use more and more is towels. And Shelly's done in TinyKittens some great brochures about how to towel restrain the cats. The cats feel very safe. And what we found is when there's a hole cut in the towel or the blanket, we just move the little hole around to the area of interest for us, and the cats. So that's a really great technique. We've also learned, which you guys can also probably know too, is that we can weigh the cat and the towel, and then when we're done the exam or the procedure, then we just weigh the towel separate. Super easy. We've also learned that you can take some really awesome x-rays straight through the towel, just a little FYI. But in case you have a cat that needs an x-ray, it totally works.
Most of the x-rays that are posted on Tiny Tapeworms at Facebook have been taken through a towel.
Yeah, and we've sent them off to radiologists and they never say anything. The other part is we have a strict no scruffing policy. Okay, and I encourage owners to not scruff at home. There's way better ways to position these kitty cats. Choose a clinic that is in love with cats. If you call them up and see, and then ideally if they're fear-free certified. The other thing that can really decrease owner stress is having pet insurance. I didn't actually think of that one, Shelly did, but that's a good one.
We have expensive cats sometimes.
So over the past 10 years, we've found some medications that are really helpful for feral cats. I don't know how I used to ever practice without gabapentin. I was taking a course recently from a feline specialist, and she said exactly the same thing, and I'm like, yes, okay, I don't have a problem. So I just loved it. Gabapentin is used in human medicine for pain and for seizures, especially nerve pain. In cats, it really helps with stress and anxiety, and it helps a little bit with pain too. And veterinary medicine, most clinics, or a lot of cat-friendly clinics, have this formulated into so many different forms that are easy to use for the cats. And so, also, just like when we are anxious in a new environment, some people may or may not reach for a glass of wine. In feline medicine, we reach for gabapentin.
Or tequila. Gabapentin has definitely been amazing for our ferals. We give it as part of our standard intake protocol, unless we suspect the cat may be pregnant. And then we continue to give it twice a day for the first couple of days, or until we're able to see them feeling safe enough to start doing normal cat things when the humans are not around. And like Renee said, we use different formulations depending on the situation of the cat. We are almost always able to find a way to make medicating them a positive experience. For example, we have had some really great reviews on our medicated meatballs, we call them, but it's basically like a capsule in a pill pocket, and then we like roll it in Fresh Temptations and add like a churu glaze. So,
I forgot to say, the medication is also very safe, and it's very inexpensive. So also great for rescue work, but also great for owners that need it for their cats at home, either long term or just sort of situationally. So.
Yeah, no, that's definitely true. We give it 12 and 2 hours before vet appointments, and even things like nail trims. Like a lot of people struggle to do nail trims at home, but if you talk to your vet about gabapentin, give it 2 hours before, you'll have a much more positive experience doing things like that may otherwise be stressful for your cat. So, and we also give it on an adoption day. and then we'll often send it home with our adopters. So they have a couple of days of, to make that transition easier.
Just quickly, I thought I would bring it up because I knew I would be sort of among my people and people who are really into cats and cat rescues. There's another couple medications that have really been a game changer with the feral cat rescuer. One is Convenient, that's over on the right. That's a 2-week antibiotic injection. It's quite inexpensive. It's very safe. You give the kitty one poke, and it has the antibiotics for its tooth abscess or dental work or abscess or injury that lasts for 2 weeks. The other one over here that we get specially made in Ontario is called sustained release buprenorphine. We give the kitty one injection, and it lasts for 3 days, and it gives them really good pain relief. The other thing we found, and there's even like ear creams, and you can talk to your vet, there's ear creams for different medications that can even help stimulate the cat's appetite. There's lots of great probiotics out there now too, where they will help the cats if they have a bit of a stressed tummy due to the environment or due to a previously poor diet, parasites, viruses, and they can go on their food and they're essentially tasteless. And there's long-term ear medications that can be used. Even with the feral cats in the hospital, we have no problem even giving them intravenous or subcutaneous fluids if needed. So there's definitely ways around to make these cats healthy and treat them with respect.
And I'm just going to also point out, so one of the benefits of using like an injectable antibiotic for us with the feral cats is it saves us from having to handle them twice a day to do something stressful to them. So it's amazing, like you completely eliminate those negative interactions for that 2-week period, and then you can replace those with the time, spending time giving them positive interactions. So that's been really amazing for us. So this handsome fellow is Croissant, and I believe his perfect soulmate is in this train station today. Croissant was part of a feral colony. They've been living in a ravine. He's uncle to the kittens you may have seen on the live stream earlier. When he first arrived, he was extremely scared and quite spicy. And we had actually planned to return him to his home in the wild. But then we found out he's FIV positive, which Renee's going to talk about in a second. And we had to change our plan and convince him life in a home wouldn't be too bad after all. And we're so happy we did, because as you can see, so this is Croissant today. It's been 92 days since we trapped him. He's an absolute angel. He is super playful and snuggly, and he has a great purr. And he's doing great. And I do realize that seeing this video, I've probably lost all credibility that I even know what a feral cat is. But if you hadn't seen him the first couple of weeks, anyway.
FIV and the disease that Croissant has is the same one that Moggy has. FIV is feline immunodeficiency virus, and it's a virus of the immune system. It's a retrovirus. Interestingly, things are really changing with regard to these retroviruses that didn't, even in the past couple of years. In 2022, the American Association of Feline Practitioners published a new retrovirus guideline, and they stated that cats in households with stable social structures where housemates do not fight are at negligible risk of acquiring an FIV infection. So mutual grooming, playing, litter boxes, bowls, all of those things, this kitty is not going to transmit FIV to another cat. However, Croissant needs to stay inside because Croissant is more susceptible to catching viruses because his immune system isn't as good as it should be. And I would even say into the recent past, these cats would 100% be euthanized. And so I think it's just from people educating and hoping that we're learning that we can save these cats and they can go on to live really wonderful, normal lives.
Yeah, we've run several FIV positive cats, and some of I think our oldest one that we just trapped had lived 16 years as a feral cat with FIV and had been totally fine. And he had other things like kidney disease and other diseases, but we've had so many that are in homes and doing really, really well. So if you're interested in learning more about this spectacular creature, you can submit an application at tinykittens.com/adopt, and we will happily answer all of your questions if that seems like it would be a great fit. You can also fall in love with Croissant and our other amazing adoptable cats at tinykittens.com/live. We're live 24/7, so you can really get to know them. And we have a catalog of social media pages of our adopted cats in their homes. So if you're still not 100% convinced, which I'm sure you are anyway, but go here and just scroll through some of the pages, and you'll see the most amazing cats living the most amazing lives. I think it's pretty compelling stuff. And we've also created a handy guide both on the web and in brochure form, which you can grab over at our booth over there, which you can bring with your cat to the vet, that has step-by-step instructions and photos for how they can safely and easily handle formerly feral cats who probably still get a little bit nervous for their vet appointments. So this brochure would be a good way to kind of, if your vets and their staff are a little bit nervous, like Renee was at the beginning, it's a great way to say, here's how you can handle them, and it will make it easier on everybody. So with that, it's raffle time and maybe question time.
Any questions?
The lovely work is going to come up.
Yeah. Do you have a question for Shelly? Yes. Yes, I work at Mountain View Vendor as well. Yeah.
Okay.
In the front row, you have a question for Shelly?
I have a painting cat regularly, every day. It's a really fierce cat. Like my cat, I have 6 of him, and try to train him for grooming, for everything, but it's so hard. I have to sedate him for trimming nails. Everything is really like, even to brush is really hard. It's really hard to do anything, and he has many skin issues. So I noticed that when I give the medication that's trazodone, he gets way more mild after. Like, it's still sedated, but he's more functional. So I was wondering if the government could be medication that he could take regular.
Yes. Yeah, that's a good question. So she was asking, because her cat is not okay with regular grooming at this point and with nail trims, can you give gabapentin long term? And absolutely. So I would absolutely talk to your veterinarian. I also work with some behaviorists, people who went to school for like 4 years longer than me, and they absolutely recommend, or under certain circumstances, at least using it for the semi long term, until we get the kitty used to and being okay with all these things. And there are some cats that come with some baggage, as we all can, that maybe need to even stay on it super long term. But you can use it situationally, or you can use it long term.
We have another question here. In that injection video, what was the plant that you were feeding to that cat? Or did you eat it?
Oh, that was fresh catnip. He loves it.
Hey, like, cat is going to a medical thing because we had a kidney stone, but there's like a spare in Mexico, and I have to take her to a medicine doctor and toilet on Tuesday. But with this, she doesn't want to leave the building. But she's not scared of it before, because I can take her out for everything, anything but right now. She's behaving like this, and last time I took her to the vet, they gave me gabapentin had no effect on her at all. When I tried to get her to get her in the carrier, she behaved like she didn't have it at all. Is there anything else that I can use? Because that was useless.
So I think also that's a good question. So you found that gabapentin didn't have a big effect on your cat. So there is some other medications. Gabapentin is safe and it's inexpensive. And the other thing with gabapentin is it has a very big dosage range. We can give a little bit or we can give a lot really quite safely. So it might be good to go back to your vet and go, hey, what dose do we use? Are you comfortable? Maybe we can consider going a little bit higher. And then sometimes also when you're working through some stuff, sometimes we do need to add a little extra stuff on top. But I would sort of say, given your cat's medical issues, talk to them. There's probably room on the upper end to do that. And then maybe also some of the other techniques to decrease stress too.
Yeah, because I talked to the vet about something stronger. They say that was the strongest gabapentin I can give her.
Yes,
So,
it may be the strongest. But then talk to them about maybe adding in some other medication too.
We have found with our feral cats especially that they seem to metabolize it really fast when their adrenaline kicks in. So we tend to start at higher doses because we know going in that a low dose isn't going to have the skin effect. Whereas my friendly social cat Bunny, if I give her like a low dose, she'll be a little bit boggy for the day. So it really depends on the cat.
And also, I don't know if you had dosed twice before, but often we recommend the night before and then 2 hours before the appointment. So 2.
Got another one here.
Hi. So recently, well, half a year back, we adopted a cat that was formerly abused. And so the cat has a problem with hands, specifically. She sees as a target of prey or attack. So when we try to play with the cat or do things with it, it often just stare at our hand and then it seems to attack a couple seconds later. So we're wondering if there's anything we can do to try to fix her behavior in that regard, or to not let it see hands as a problematic.
So I think Shelly was saying that the cat is sort of playing or attacking your hand because it was abused. And sometimes also there's sort of some misguided ideas of what is acceptable play, and maybe somebody did do that. Is what I think I would try to do is like redirect the cat to like non-toys. And that would probably be just so that basically attacking the hand is not an option and trying to extinguish it. Do you have some other, depending on it, could be.
We've worked with some behavioral specialists and not like abuse-related hand targeting, but some similar kind of overstimulation type of stuff. And they recommend a whole variety of things, but it would be really useful for you to consult with a behavioral specialist because they'll have some good ideas. Often they'll suggest like backing up your interactions so that you're doing fewer up-close interactions, but maybe more far-away interactions, or tossing a treat for them, like Renee said, playing remotely with them, and try to figure out what will create a positive interaction versus what might trigger their fear response.
Yeah. And puzzle toys and doing those kind of things, it's a really good question. It's just one that's hard to answer in like 60 seconds, because I totally understand your frustration. But yeah, I would probably consult with your vet and then see if they can have some ideas after maybe having like a half an hour, 45-minute conversation and going, okay, what are the triggers? And then using some puzzle toys and different ways of playing to sort of take it away from the attention away from the words.
Just have one more here.
So I just had a question. My cat recently just got arthritis in its back, and when the vet tries to take him out of the carrier, they have to fully sedate him, like put him to sleep, I guess, like to check him and everything. They've never suggested gabapentin, I think it's called, so how would I go about asking them? Because the only thing they said is they could only fully sedate him because they're terrified of him, but she used to see my cat had no issues. It's medical.
Yeah, so I would honestly, I think most veterinarians are usually very approachable and going, hey, I learned about this on the internet, or I learned about this from going to the cat. So is gabapentin an okay option for my cat? And I think also about getting them in and out of the carrier is if you can put your carrier in your environment and teach the cat to go in and out willingly, because then when you get to the vet's office, the cat's going to already go, hey, my mom taught me this trick. The other cool thing that I'll just sort of do, there is an amazing cat arthritis medication that came out 2 months ago. I got so excited. It's a game changer. Not to promote, I don't work for Pfizer, but it's called Silencia. You might want to look into that too. It's like awesome.
Yeah, and I think if you bring, like, with your checklist when you go to the vet, let them know, like, if the top comes off your carrier, let them know that and ask that they examine the carrier too. Because there are different things that they can tweak to approach their cat differently that will help make them more comfortable.
Because we don't want to bring the kitty out of the carrier and then we just be poor kitty scared because they think we're going to hurt them. That's the opposite of what we're trying to accomplish.
We're just going to take one last one. You guys have great questions, sorry, but in the interest of time.
Hi, I have one cat who's 1 now, and she was rescued from a feral cat colony when she was like a small kitten. And she has a bit of anxiety about being alone, and she suckles on herself still. I'm just wondering if that's okay or if she'll grow up and...
That's pretty normal. It's pretty normal when they're, especially if she was separated from her mom and litter mates when she was younger. We usually don't see it as a problem unless they're creating wounds, on themselves. But something that might be really helpful is a little friend to play with. So, not to try to upsell you, but there are a lot of TinyKittens here today. Oh, TinyKittens comment. Do they ever suck on each other or something? No. And you can also, those like really soft blankets, does she ever try to nurse on those? Okay. Yeah. I think,
I think also redirecting it, then I would also say, like, depending on what the degree it is, because it's not uncommon, I'd be like, hey, it's cute, or are they doing it so much that they're actually ingesting the fabric, or you can also give them also some puzzle toys, so they're spending part of their day and their energy working for their food, and not just like, what am I going to do today? I'm going to suck on my arm, or something. They're like, I have to work for my food, I have to hunt because that's what I was made to do. Directing them like that. You can even smear some yummy food or cat food or something like that on a rubber toy, because rubber is the best thing for their teeth. There's a whole bunch of little tricks like that. And then also, depending on how bad it is it actually causing a problem, or you guys a problem?
Right. So I think that's it. So real quick, we've got our winning raffle tickets here. Thank you to everyone who bought them. Your contributions are helping us to do the work that we do, so we are really, really grateful to all of you who purchased raffle tickets. Thank you so much. Yes, Brooke, also Snuggler Extraordinaire, will escort you to your prize. Excellent. Well, thank you guys so much for coming and for your great questions, and we really appreciate all of the support, and thank you again also for...
Thank you guys so much. One more round of applause here for Shelly and Dr. Renee. And you guys have some amazing questions, so I hope everybody took something away from that. I certainly learned a lot. And who's ready to rescue a feral cat today? Take on that challenge. Yeah, everyone. Right. So the good news is they are still here till about 5 o'clock. So you guys can go and check out their booth and ask them any more questions. So, guys, this is the meowment that I've been dreading, but our show has come to an end today.